In this video, you'll hear a health department interviewer conducting an interview with Quinn Smith, a resident of Boone State Prison who has been diagnosed with a salmonella infection. This video models how to navigate a telephone interview with a person who is a resident of a correctional facility. While we use the term resident of a correctional facility in this scenario, there are many ways to refer to individuals who are detained or incarcerated. If you would like to review other terms, look at the Minnesota Department of Health Inclusive Language Guidance linked below this video. This list is a good place to start, but terminology and preferences may evolve over time, so it is important to mirror language individuals use to self-identify. To prepare for the interview, work with facility staff and colleagues to gather information about the resident and facility that may help the case investigation. A few suggestions to help you get started are listed here. This list can also be viewed in a job aid document linked below this video. The interviewee is a resident of Boone State Prison. No one at your agency has worked with the facility before. You call the warden after finding the information on the Boone State Prison website. He refers you to the associate wardens for custody, overseeing safety and visitation, and operations, overseeing facility and food services, and the medical administrator. You speak to these individuals and try to maintain patient confidentiality, only disclosing Quinn's name and illness when necessary, and learn the following.
Quinn has resided at the prison for 2 years and shares a 2-person cell equipped with a bunk bed, toilet, and sink. He is in the 3rd year of a 5-year sentence and does not have an estimated release date. The prison has a farm where Quinn works with poultry on Mondays, Wednesdays, and Fridays as part of an agriculture work program.
Prison residents have a few hours of recreation time each day where they may interact with other residents in indoor and outdoor communal areas. All food is prepared off-site by a contractor and served to residents 3 times a day in a mess hall staffed by incarcerated food workers.
Quinn sent in a request to go to medical after 3 days of abdominal cramps, fever, vomiting, and bloody diarrhea. Lab results came back positive for salmonella. Quinn was treated with fluids and released back to his cell. He is still having loose stools, and his cellmate recently developed symptoms.
The associate warden of custody allows you to conduct a 15-minute phone interview with Quinn. Quinn will be using a landline located just outside of the warden's office. The call will not be recorded, and prison staff will not be on the call, but a correctional officer will be nearby supervising Quinn. Building rapport is critical to a successful interview and obtaining complete exposure information. Start by introducing yourself in a professional yet friendly tone. Remind the resident that their responses will remain confidential and that limited information may be shared only when needed. Hi, Quinn. My name is Taylor. I'm calling from Boone State Health Department to talk to you about your recent illness. Would you be willing to tell me a little bit about your illness, including what you experienced and when?
Yeah, I was really sick last week. I couldn't keep anything down for 2 days. It was horrible.
Oh, I'm sorry to hear that you weren't feeling well. We at the health department were notified that the lab test that you had came back positive for salmonella. Has someone already notified you about these test results?
Not really. They said I had a bacteria, but I didn't know it was called salmonella. Is salmonella really bad?
Salmonella infection may cause diarrhea, abdominal cramping, nausea, and vomiting, and is contagious. Doctors and laboratories are required to report certain conditions like salmonella to the health department so we can follow up with patients about their illness. I'd like to ask you a few questions to see if we can figure out what made you sick. Hopefully, we can use what we learned to prevent you and others from becoming sick in the future. Would you be willing to talk to me today about your illness and the things you did before becoming ill?
Yeah, that sounds okay, I guess. Can I get in trouble from anything I tell you?
I really appreciate you helping me with this. I'll only use the information you share to help prevent others from getting sick. If something you mention points to a possible cause of illness, we'll work with the staff there to make changes. Even then, we'll only share the minimum amount of information needed. My main priority here is finding out what made you sick and preventing others from getting sick.
I guess that sounds all right.
Gather as much relevant information as possible about the resident, the facility, and food operations from facility staff beforehand. This is helpful so that you can reserve limited interviewing time to ask about specific exposures. Great. And if you don't feel comfortable answering anything, you can skip the question. Can you tell me when you started feeling ill?
Yeah, I started getting cramps and nausea last Tuesday afternoon. I was reading a new book I got from the library that morning and it just hit me.
And were those the only symptoms that you had?
No, I also threw up a few times later that night and the next day.
Did you have any diarrhea?
Yeah, some of that too, but I'm pretty much back to normal now.
I'm sorry you experienced all those symptoms, but I'm glad to hear that you're feeling better. Do you know of anyone else who has had similar symptoms?
Yeah, my cellmate got sick yesterday. He started throwing up right after we got back from lunch.
Oh no, that doesn't sound nice at all. I hope he starts feeling better soon too. One of the things that we know about salmonella infections is that they can be spread through food and drinks. So next, I would like to ask you a few questions about the foods you ate during the week before you were feeling sick, which would have been the 3rd to the 10th. I understand that you have a kosher diet. Is that correct?
Yes.
Great. I have a menu of kosher foods that were served the week before you got sick, and I'm going to run through that list now. Please tell me yes or no whether you ate the food or not. You can also let me know if you don't remember. We'll start on March 3rd. Did you eat? I know that was a long list of foods to go through, so I appreciate you bearing with me. Did you share food with anyone else in your unit during this time?
No, I tend to just stick to my own meals.
And did you purchase any food from the commissary that week? Again, we're looking at the 3rd through the 10th.
I can't remember if I did specifically that week, but I usually get canned tuna or chili from the commissary and sometimes chips or Snickers.
I also hear that you work with some poultry on the farm there. Another way salmonella can spread is through contact with infected animals. What are your responsibilities at the farm?
Yeah, I mainly take care of the chickens, giving them food and water, getting eggs, cleaning up the poop and bedding, that type of work.
Can you walk me through your typical day at the farm?
Well, I change into my work clothes after breakfast and report to the farm at 8 a.m. I usually start by checking on the hens, feeding them, replacing their water, and letting them out. Then I gather eggs from all of the coops. I check the bedding when the hens are all out and replace any wet or dirty straw.
Do you use gloves or mask when you handle the hens or the bedding?
I usually put on gloves and a mask when I have to go in and shovel out all the bedding, but not when I'm just feeding the hens or getting the eggs.
And how often would you say do you have to clean out the bedding?
There's a lot of hens, so they have us changing them out a few times a month.
Did you change the bedding during the week before you got sick?
I don't know, maybe, like I said, I clean them pretty often.
Residents may be able to differentiate days of the week with set routines and job schedules, but may have difficulty distinguishing one week from the next. Try to identify key dates or other events during their exposure period to help jog their memory. Okay. Is there anything else you usually do on the days you work on the farm?
Yeah, I have rec right after my work hours, so I head to the TV room to watch some baseball if there's a game on. If not, I'll go to the yard to work out or play some basketball.
Hmm. It looks like the Bruin Lions played the Bears that week. Did you happen to catch that game?
Yeah, that was a great game. The Lions dominated.
And do you remember if you happened to clean out the coop that day?
Oh, yeah, I did clean the coop that day. I couldn't find my gloves at the farm and got a bunch of crud on my hands from cleaning out the dirty straw. I missed the first two runs because I went to wash my hands.
Facility staff may be present at the interview or within distance to overhear the interview. So try to maintain as much privacy for the resident as possible. Ask questions in a professional, unbiased tone. Okay, next I want to shift to some more sensitive questions. I understand that a correctional officer may be within earshot of you right now.
Yeah, there's one a few feet away.
Okay, I want to help keep our discussion private, so I'll try to ask any sensitive questions in a way that you only need to respond yes or no to so that the officer doesn't know what we're talking about. Does that work?
Yeah, that works.
Great. So we've had experience with other residents getting salmonella from food they've taken from the cafeteria to eat in their cell at a later time. For example, there was one resident who took some chicken from their lunch tray and mixed it into some ramen they got at the commissary, and he ended up getting sick. Do you remember taking any food back to your cell in the week before you got sick?
Yeah, I do that sometimes. Everyone does it.
What foods did you take back to your cell during this period? Again, we're looking at the 3rd to the 10th.
Oh, well, I think there was half of a chicken sandwich and maybe some hard-boiled eggs too.
Do you remember how long you kept the sandwich and eggs before you ate them?
I don't know, maybe 4 or 5 hours. I took them back after lunch and had them as a snack before dinner.
Okay. Thanks for sharing that with me. What type of chicken was in a sandwich? Was it a chicken patty or shredded or sliced chicken?
It was a patty. I saw something on the news about mechanically separated meat and food poisoning. I'm pretty sure this chicken was that. Do you think the patty could have caused the salmonella? You're with the health department, right? Like health inspectors that can shut down restaurants for violations. Can you get the kitchen to stop serving that stuff, or can I log an official complaint or something?
If the resident asks to pursue legal action, acknowledge their request and let them know you are unable to provide this type of advice. Restate your role and redirect them to the interview questions. Unfortunately, I can't say for sure if the patty caused your illness, and it's unlikely I can get the facility to make any changes to the cafeteria menu. However, by answering my questions, you're helping us identify all the possible ways you might have gotten salmonella. We don't always find the exact cause, but the information you provide can help us work with staff to make improvements that might prevent future illnesses. For example, we can talk to a food service manager about safe food storage and preparation practices, and we can work with farm staff to make sure that changes of clothing or aprons are available when cleaning out the coops. And bacteria like salmonella can quickly multiply in cooked food that's left at room temperature for too long. So if you do take food back to your cell, I suggest bringing back foods that don't need to be refrigerated, like bread or cereal. If you do prefer to take back meat or eggs, don't let them sit very long before eating. And if you get canned tuna or chili from the commissary, try to eat them shortly after opening, and don't save any unrefrigerated leftovers. I'm not authorized to log a complaint for you. I believe that needs to be done through a written form that you can get from a staff there. I can help request one for you if you'd like. Does all of that sound okay?
Got it. Thanks, I guess.
Okay. Next, I'm going to ask about some areas you may have visited in the week before you got sick. You mentioned you were in the library, TV room, and yard. Did you spend any time in the rec room? Do some research and prepare for the interview by working with colleagues and facility staff to gather information about the resident and facility that may help you in the case investigation. This can include reviewing resources such as the Colorado Food Safety Center of Excellence Guide for working with correctional facilities, looking at the facility website, speaking with facility staff to learn about food and facility operations, gathering relevant information about the resident, and confirming interview logistics. Make sure you take time at the beginning of the interview to build rapport with the resident and address any concerns they may have about confidentiality. Reassure the resident that you will share only the minimum amount of information needed for disease control purposes. You may have a set amount of time for the interview. It is important to obtain as much information about the resident and facility as possible by talking to facility staff beforehand so that you can focus the interview on the resident's exposures and activities. It may be hard for residents to differentiate between weeks with set routines and job schedules. Use key dates or other events to help jog the resident's memory about their exposure period. Facility staff may be present at the interview or the resident may be in a common area with others present. Do your best to maintain privacy during an interview. This can include asking sensitive questions in a yes-no manner so that the resident can respond without others knowing what they are responding to. Be sure you introduce questions in a professional and non-biased tone. Explain that you cannot provide legal advice. Restate your role as a public health professional and redirect them back to interview questions.